Ryan Reynolds here from Mint Mobile. With the price of just about everything going up during inflation, we thought we'd bring our prices down. So to help us, we brought in a reverse auctioneer, which is apparently a thing.
Mint Mobile Unlimited Premium Wireless. How to get 30, 30, bit to get 30, bit to get 20, 20, 20, bit to get 20, 20, bit to get 15, 15, 15, 15, just $15 a month? Sold!
Give it a try at mintmobile.com/switch.
$45 up front for 3 months plus taxes and fees. Promo rate for new customers for limited time. Unlimited more than 40 gigabytes per month. Slows full terms at mintmobile.com.
I don't remember anything that happened at the hospital when my son was born. I can't remember which room I was in, and I round on newborns at that same hospital now. Do you remember when your baby was born? Do you remember them getting a vitamin K shot or eye ointment? It's all a blur, right? So many people come in the room, so many things happening. Do you remember planning for the birth of your baby? That time, I think, is clearer to me. I knew what to expect. I mean, I had delivered babies myself at that point and taken care of so many newborns. And then I had a C-section, and I have absolutely no idea what happened in the few hours after surgery. So go ahead and make your birth plan. But do you know what really should be on it? If your kids are older, do you know what happened in the birth hospital and why? I'm going to explain. I'm Dr. Wendy Hunter, and I'm the pediatrician next door. I'm that doctor friend you call for practical advice about your kids' health. I mix the science of medicine with the reality of parenting. Everything that is done in the birth hospital is on a checklist. The hospital staff is a well-oiled machine. There is a system for putting a hospital band on the baby so they don't get mixed up with another baby, and they put on a security alarm. There is a protocol for everything that happens and a history of how that event got added to the checklist. There is an algorithm for every complication that can possibly happen. We have charts and formulas for scenarios like if the baby has a fever or jaundice. I mean, airplanes have the same thing. They have algorithms for in-flight fire or for a lost engine, because in both instances, flying planes and in a newborn's health, there isn't a lot of time to make an error. Time is critical here. Everything we do for a baby in the newborn ward, we do because they keep babies safe and healthy. And everything that happens is based on research from a whole population of people. So for example, if you take 100,000 babies, a few of them are going to have an eye infection as a result of birth. And so as a result, now we put eye antibiotic ointment in every baby to prevent infections. Everything that happens in the hospital is done on a checklist, and your baby is part of that process. Immediately at birth, there are 2 issues you need to plan for. One is for clamping the cord, and the other is about skin-to-skin contact. Everybody already knows you should put your baby skin to skin as soon as possible. We call that the golden hour, and you should hold your baby for at least an hour right after they're born, even if they don't nurse. Babies have a reflex, and they will climb up your body and latch and try to breastfeed, which is really incredible. So that's the first decision. You should insist on the nurses giving you the baby immediately. They don't need to go and wipe the baby off. And obviously, if there's an emergency, let the doctors take your baby and resuscitate her. The second issue right at birth is regarding cord clamping. The new trend, which is scientifically based, is to delay your cord clamping for a few minutes. And the doctors and the nurses and the doula, they can help you make that decision together. But it's tough because every hospital is different and every physician is different. I mean, it'd be terrible, but you might have an obstetrician that'll just walk in the room and they're going to just clamp the cord, cut it, and walk off because they have somewhere to be. But say you have a doula there, the medical staff will recognize that and they'll think, okay, this is a thoughtful family. And you have more eyes to make sure that they delay clamping the cord a bit longer. Okay, so what's the right amount of time? I don't know. It doesn't need to be longer than a minute. You're just waiting for the blood from the placenta, which is the baby's blood, to go back into the baby. So the baby really just needs to take a few breaths. And once they do that and they're breathing comfortably, that's when the pulmonary vasculature that fills up. Those are the blood vessels around the lungs. And then that allows the blood to transfer back from the placenta. So that can happen in probably like 10 breaths. Back to the antibiotic eye ointment. That was initially started to be used because we were trying to prevent the baby from getting a gonorrhea eye infection. And where I live in the state of California, it is a law to apply the ointment because gonorrhea used to be the number one cause of childhood blindness. So now that actually is much less common of a cause, but we still see infections from other bacteria. They can come from the mom's skin or from mom's intestines. So we're putting 1 dose of antibiotic on the eyes so that the babies don't have infections from the birth process. And this does not have to be done immediately. It can be done a few hours after birth. So that allows for skin-to-skin time. But if you really think about it, I mean, a lot of new parents, they ask me not to have the eye ointment and they'll say like, I don't know, I don't have a disease. But the truth is, we are talking about a topical antibiotic ointment for 1 dose. That is like not going to do anything harmful to your baby, and it's not going to cause any problems. So just do it. You know, the baby came from a kind of messy place, and they got goo with your intestinal contents mixed in. So I'd err on the side of caution. It's not different than putting Neosporin on a cut, even though the cut's not infected. There's another situation that comes up. If a mother has group B strep, and I know ideally the parent should have 2 rounds of antibiotics 4 hours apart during labor, but if you have a quick birth, you may only get 1 dose. Oftentimes they will do a blood test on the baby a certain number of hours after birth to look at their white blood cell count and just to see if it's too high. So it's more of a watch and wait situation. What about vitamin K? I don't understand why people avoid giving this shot. There's really no harm to a vitamin K injection. So the story here is that basically babies are born with a little bit of a vitamin K deficiency, and vitamin K is needed to clot your blood. There's probably a survival benefit to the baby having a low vitamin K level so that they don't clot their umbilical cord when they're born. But you can't walk around or be carried around with a low vitamin K level. Before we gave vitamin K shots in the hospital, 1 out of 100 babies had bleeding from either their belly button or their mouth, or sometimes even in their brain. It's called hemorrhagic disease of the newborn, or vitamin K deficiency bleeding. And it terrifies pediatricians because you can bleed into the brain. It was a pretty high percentage of kids who had brain bleeds, which was really alarming. The shot of vitamin K that you put into the muscle of the baby's leg is pure vitamin K. There's nothing else in it, and it slowly releases over weeks after the baby's born. There is not an oral form that works well because even the oral form, if you did give vitamin K, it's not absorbed. The shot is basically like what the baby would get if they stayed in the mom's womb for another 3 months. But if you stayed pregnant for 3 months, you could fully form the baby and then not be able to deliver them because they would be gigantic. So I don't see any harm in giving vitamin K shot, and there is significant potential harm if you don't. What about vaccinations in the hospital? Probably the most important vaccinations that are done are the ones that are given to the mom when she's pregnant because she gives her immunity to the baby. And the other important thing about vaccine preventable diseases is to surround yourself with other humans who are vaccinated. Don't let anyone around your baby who has not been vaccinated. For whooping cough, that's the pertussis or P that's in the Tdap vaccine. For the baby, it's pretty routine to give the first hepatitis B vaccine while the baby is in the hospital. And we do that because it works very well when you give it to someone young. Hepatitis B is devastating. 90% of kids who get hepatitis B have liver complications and can go into liver failure. I've seen those kids. They're green, literally, and I've seen lots of them in the hospital over the years. Hep B is not easily transmitted, but what about if you don't think that your baby is going to have a risk of exposure to Hep B? There are people that are walking around who might be holding your baby who have chronic hepatitis B, and you wouldn't necessarily know. It's not like people wear a t-shirt that says, I have Hep B. It's true. You really do have to be in very intimate contact to get hepatitis B from another person. So it's not likely, but it does happen. The other weird scenario I've seen was a baby who was at daycare and she accidentally got another mother's breast milk. So then we had to check that the mom didn't have hepatitis B and that the baby was vaccinated. It got really complicated. It's pretty unlikely, but this is a vaccine babies get that we know works really well when it's given at their very young age. We can give it at 2 months, 4 months, and 6 months. So you don't have to give it in the hospital. You can give it a little bit later. Even though you can give it a little bit later, I want to get on my high horse here for just a second. I don't like to talk a lot about immunizations because they can get controversial, but let me just say, parents who delay giving the Hep B vaccine, they end up having to give it to their 3 or 4 or 5-year-olds so that they can go to school. And those kids are mad. So maybe just get it out of the way when they can't hold a grudge against you. When should baby get his first bath? We used to bathe the baby immediately, but now we recommend holding off on the bath. So you know how babies have that white cheesy stuff all over their body when they're first born? That's called the vernix. It provides a great way for your baby to transition to our environment. So you don't want to wash that stuff off. It's also full of anti-infective properties, and it has natural fats that help keep the skin to not get too dry. So we like leaving the vernix on for maybe a week. I know that sounds kind of gross, but if their hair is really matted down, go ahead and give them a little shampoo because it can get pretty gnarly. All right, what about umbilical cord care? When my kids were born, we cleaned the umbilical cord constantly with alcohol. And since then, we've realized that caused the umbilical cord to stay on too long. So there's been a big swing now, and we say to let the cord dry naturally. We've learned about disinfectants that they aren't needed to keep the cord clean. There's natural bacteria that keep your body bacteria in check. So you want to let the cord dry up and fall off on its own. It is okay to take a bath when your child's cord is still on. That's fine. And a lot of people try to wait, but you can just tell grandma that Dr. Hunter said, no, it's fine. And the other thing about umbilical cord care is that a lot of people are going to put like a coin on top of the belly button and tape over it to tape over the umbilical stump and prevent an outie. But it's not going to prevent an outie, and it can cause irritation and infection. So don't put anything on top of the cord. What does cause an innie or an outie? We don't really know. We think it's genetic for the most part, but the point is it is not the doctor's fault. Some kids do have a little bit of a hernia at their belly button. It's really common, and that can sometimes leave you with an outie, but it's just one of those things that you get. What about circumcision care? This is funny because I don't do circumcisions myself, and I refer baby boys to another doctor, but people always ask me, how do I care for it later? And let me tell you, you would be shocked at how quickly circumcisions heal. Honestly, it's like you put the diaper on and you blink and all of a sudden you look and you can't even tell they had a circumcision. So basically, you just put Vaseline on top of the penis and leave it on for a day or two, and it just heals. Babies have a great blood supply and they heal miraculously. You know how if you accidentally scratch a baby and then you feel horrible about it, and then like an hour later, you can't even see the mark? They're very forgiving. What can someone expect in terms of feeding in the first month or so? First of all, picture your baby. Look at the size of them, and then picture how small their stomach is. It's like the size of a little walnut, maybe not even that big. You can't expect a newborn to eat 2 or 3 ounces. They'll spit it up because there's no space. In those first couple of days, mom should start making some colostrum. That's that really thick golden substance, and you're not going to get very much if you pump. Try and measure it. You'll get like 2 or 5 milliliters. We're talking about like a teaspoon or a tablespoon. That stuff is nutrient dense. Colostrum's magical, and it will serve your baby well for even a couple of days. Babies are born with a ton of extra fluid in their bodies, so they're not going to get dehydrated in the first 48 hours, even if they don't really drink that much. So the goal in those first couple of days is to put the baby to the breast often, and that will help bring your milk in. We expect babies to go down below their birth weight up to almost 10%, and that's normal. Right after birth, They're born with all kinds of extra energy and water so they can just sleep for a day or two. And a lot of them are going to be really pokey at first. They don't want to latch and they don't want to feed. You just need to give them a little time. And this is just the tip of the iceberg on feeding. A lot of pediatricians do miss this one crucial thing, though. Parents need to know that mothers get a lot of IV fluids during labor. And I will often consider the baby's birth weight to be the weight that the baby was when it was taken on the second day of the baby's life. They're going to pee a lot in that first day. And I think a lot of pediatricians start to panic when they see the baby at 4 days of age and their weight is down like 12 or 15%. And they encourage mom to start supplementing with formula. But the truth is, the baby's weight is not down as much from their real birth weight as it seems. So look at mom. If mom's feet are swollen, you know this is the issue. The baby was also swollen, and that birth weight was overinflated. We've got to stop over-medicalizing this and just give moms the space to let their breast milk come in and let the baby figure it out. The best way you can tell if the baby's feeding well is if the baby seems relatively satisfied most of the time, then you know they're getting plenty. They don't need anything. So I wouldn't start a supplement unless a baby is searching and crying frantically. And then I'll tell you the way I would supplement. I don't think formula is an F word, so I'm okay with formula. I do want all moms to breastfeed, but in the interim, if you really don't have any milk at all and you just need a day and the baby is frantic, I like to use something called a supplemental nursing system. It's a long, skinny tube and it attaches to a small syringe. And you can put literally like 5 or 10 milliliters of either expressed breast milk or formula. You put it in the syringe and then you stick this teeny tiny tube on your nipple into the baby's mouth while they're at the breast. And oftentimes they'll have such a good latch that they will just suck the extra milk from the syringe. So we're talking about a cord that's probably like 18 inches long, goes on mom's nipple over her shoulder, and then another caretaker can hold the syringe and push it down if the baby is not sucking well enough, and they'll get plenty of supplement. Everything's going to change in the first 2 weeks, and you just need to give yourself a little bit of time. You do not have to be perfect. One sign you can look for the baby that I know parents get really anxious about whether the baby is hungry or not. If they're just laying there, if you stroke their cheek gently, they will turn towards your finger and open their mouth if they're hungry. And if they're not hungry, they're just going to ignore you. So that's a really good way to tell if your baby's satisfied. The other way to tell that your baby is eating plenty is if they pee every 3 hours or so. If they're making good wet diapers, then you know that they're eating something. I know it can be really hard to breastfeed because you don't know what's going in, but just give yourself some time and go to your doctor and get weight checks, and then you'll know that they're getting something. What should we expect in terms of a baby's sleep pattern? It's going to change a lot, of course, too, but just focusing on the first few weeks, it can literally be anywhere around the clock. The thing is, babies don't make melatonin, so they aren't going to have a cycle related to sunlight or anything like that until they're probably 3 months old. You have to adjust your expectations. When you were pregnant, the baby slept when you were moving around. They were lulled by your movement. So if you're moving them around, they're going to fall asleep. If you don't move when you're pregnant, babies tend to be more awake. So when you sleep when you were pregnant, you're not moving, baby is really active. So once they're born, they're going to have that same kind of pattern. They may still stick with being awake when you're asleep, but also if you go and move them around, if you put them in a baby carrier and you walk around all day, they're going to sleep. So try to keep them stimulated during the day, lay them down or hold them and talk to them and look at them and try to keep them awake. But they're going to sleep when they want to. Probably the most common pattern is that a baby is going to eat for 20 minutes or so, then they're going to be awake for literally like a few minutes, and then they're going to go to sleep for about 30 minutes. They're going to do that cycle over and over again. So you're talking about a 1 hour cycle, basically. It could be as long as 3 hours, but they're going to sleep most of the time. There's so much to talk about with sleep. Just know there are physiological processes that are developing, and you will get to know your baby better and understand their cues, and you have resources to help you. Before the baby comes, we think so much about the birth process and the birth plan, and we think about how we're going to take care of this baby. But I think a lot of mothers don't think about a postpartum plan and the first few weeks of taking care of themselves and recovering. First of all, don't rush home. A lot of people want to get home. Stay for a day or two if you can, because you've got this support in the hospital. The other thing is family. Dealing with family coming around, they all want to see the baby, and you need to decide on your boundaries, especially if it's your first baby. You want to be home with your partner and really bond with the baby and be allowed to walk around with your shirt off and be the mess that you are. So talk with your partner about your boundaries and how many visitors you want at a time and who can come and how long they can stay. It's fine to tell people that they need to go home. It's fine to tell them that they can't come by. This is about you and creating your family together. Okay, what about protecting the baby from illness? Like not letting anyone near a baby if they haven't had their whooping cough vaccine. And obviously, people should wash their hands before they come in or touch the baby. The most dangerous person to be around your baby is a toddler. They are gross. They are petri dishes. They go to school. They pick up stuff there. It's your friends who have a 3-year-old at home that goes to daycare that I would avoid. But it's so great because in this post-pandemic era, nobody minds putting on a mask. Just ask visitors to put on a mask when they have their face in the baby's face. For us pediatricians, in the first 28 days of our baby's life, we cocoon them like you wouldn't believe, because we know if a baby gets a fever in the first 28 days, they have to get a full workup with a blood test, a urine test, and even a spinal tap. So you should be very vigilant in the first 28 days. After that, it's not such a big deal. Once you know what you want, how do you get everyone on the same page? We all used to recommend having a written birth plan, and literally, I think most of the time it just goes right out the window. There are so many variables at play that you can't have too high of expectations about what's going to happen, because inevitably, like me, you'll end up with a C-section and it's all irrelevant. But yes, educating yourself on all the things I just talked about, so knowing what's good. You will have a pediatrician that's going to see your baby in the hospital, and you can ask the pediatrician to help guide you with these things too. But be assured that if new parents don't want to have their baby bathed or they want to have delayed cord clamping, I feel like most hospitals are doing this now, but it can be hard to communicate because the nurses change shifts. So you could have one nurse and then you tell her everything you want, and then the next nurse comes in and they have no idea what you wanted. I had patients who did not want a vitamin K shot, and the baby was given one just because it's routine and it happens and it's just chaos in the room. So you have to advocate for yourself. Try and be aware and have someone there with you who knows what you want. It's always a good idea to have a partner or a doula or a friend who knows your wishes and can keep an eye out for things. And one final thing, nobody talks about postpartum anxiety. We talk a bit about postpartum depression, but just the act of having a baby that you now are responsible for the rest of your life, that's anxiety provoking. So just know you have people out there to help you. It's okay to be anxious. It's okay to be scared. My biggest piece of advice is to write down every question you have, because inevitably you go to the pediatrician and you don't remember anything at all that you wanted to ask. We are there to hold your hand the whole way, and we want your questions. I can usually anticipate parents' questions, but the worst is when you leave the office and you're like, oh God, now I remember what I wanted to ask. Use your resources. Contact your pediatrician through their online portal, talk to your friends, read blogs, follow people like me on Instagram, and give yourself time to heal. Allow yourself to feel anxious and recognize it, and know that it's okay and it's normal, but also recognize if you think your anxiety is out of proportion to how anxious you think you should be, because there is help available to you. Trust your instincts and know that you are able to advocate for your baby, and everyone wants to help you. For more from the Pediatrician Next Door, find me on the web at pediatriciannextdoorpodcast.com. If you've got a question about the weird things kids do, send an email to hello@pediatriciannextdoorpodcast.com for a chance to hear your voice on the show. I'm Dr. Wendy Hunter, and I'm the Pediatrician Next Door. This show is produced by Red Rock Music. Make sure to subscribe and leave a review wherever it is you're listening. I'll be back next time with more.